Hello, I'm Amy from Epicenter and we are interviewing Dr. Carmen today.
Hi everyone, I'm Dr. Carmen James and I'm so excited to be here with you.
We're going to be talking a little bit about COVID and Dr. Carmen's personal experience of having the COVID virus.
So yes, I did contract COVID-19 and I'm feeling so much better now, but we'll talk more about that later.
So, Dr. Carmen, what exactly is COVID-19?
So COVID-19 is the disease that happens as a result of contracting SARS-CoV-2, which is a type of virus. In fact, it's a coronavirus. There are a number of different coronaviruses. They're actually a family of viruses. They mostly affect animals, but they sometimes are able to infect human beings. And this strain of coronavirus is obviously developed into a pandemic. And so that's basically what it is.
So, would you say that we've had corona before, just in a different version?
Yes. So some examples would be the SARS outbreak. Some people may also know the MERS outbreak as well, the Middle Eastern Respiratory Syndrome. And then there are a number of other coronaviruses that actually cause flu-like symptoms that have been circulating for many, many years now. So it's a family of viruses. This is just a novel or a new coronavirus that we've never seen before.
So when you say novel, does that mean we don't have any antibodies or protection against it?
That's exactly what it means. It means that because humans have never been infected with this before, we actually don't have immunity to this particular virus.
Even though we may have had corona before, it's completely novel.
That's exactly right. Because we haven't seen this particular strain of coronavirus before, we don't have immunity.
So what exactly are the symptoms of coronavirus?
Okay, so the symptoms, much like all other coronaviruses, they usually are flu-like in nature. So if you think about how you feel like whenever you have a cold or the flu, you may get a bit of a cough, a bit of a sore throat, maybe you'll feel like you have body pain, chills, a fever. These are like the common symptoms that we see with COVID-19. But then there's some atypical symptoms that we also see. For example, some people may have conjunctivitis, so redness in the eyes. Some people may lose their sense of taste or sense of smell. Some people may even have diarrhea or vomiting. So the symptoms can be quite different from person to person. But in general, because coronavirus affects the respiratory tract or the airways, the symptoms generally tend to be flu-like in nature.
So how long do you think until you experience the symptoms once you get infected?
Okay, so you're speaking about the incubation period here, and this is something that is very interesting. As we're learning more about this infection, we're learning that the incubation period can vary quite a bit from person to person. But typically the general understanding is that it can range from anywhere from 2 days after you've been exposed to the infection to 14 days until you start to develop symptoms.
Oh wow, so when exactly would you start becoming infectious?
So you can actually begin to shed virus before you start to get symptoms. In fact, there's some people who develop no symptoms whatsoever, and those people are known as asymptomatic, meaning that the only time we actually know that they contracted or they have COVID-19 is if we were to do a test. And so it is possible for you to be shedding virus even before you develop symptoms, in other words, in the pre-symptomatic period. And then as soon as you start to develop symptoms, we know that you are shedding the virus into things like your mucous membrane. So whenever you cough or sneeze, you'll be shedding virus into it.
So a person that's asymptomatic, who's not coughing or sneezing or anything like that, they wouldn't be infectious, right?
They can still be. And this is the reason why it's so important for us to all be considering others, especially when it comes to doing things like wearing face masks, etc., is because people who don't have symptoms can still be spreading this infection.
So if my friend forgot her mask, I shouldn't lend mine to her, for example?
Absolutely not. Sharing of masks is absolutely not a thing that we should be doing.
Even if I look like I don't have it, I may not know.
Correct. So you may not realize or know that you actually are actively shedding this virus. And so in particular when it comes to things like how do people with no symptoms, if we know that the virus is being spread by coughing and sneezing and then those droplets landing on surfaces and people touching them and touching their eyes, nose and mouth, then the question becomes, well, how do people with no symptoms spread this infection? The answer is people with no symptoms who are positive for COVID-19 are still shedding virus into their mucous membranes, via their mucous membranes. So even, for example, when you're talking, you may be spreading droplets into the environment, which can then also be contagious to the next person.
Oh wow, okay. Thank you so much for sharing that with me. I feel like I've made that mistake in the past. So how would you say the best way would be to protect yourself from this virus?
So if we think about how the virus spreads, it spreads when people come into close contact with each other. We mentioned droplet infection. We also mentioned touching surfaces with unwashed hands and then touching your eyes, nose, and mouth, right? So just by understanding how this virus spreads from person to person gives us a bit of an understanding about what we can do to avoid that. And so we know that we've been told to keep our distance from others because of that droplets infection that comes out. Aside from that, making sure that we're wearing a mask is very important because when we wear a mask, we are catching those droplets that would have been otherwise spraying into the environment.
So if I talk to you, it can almost, even if I'm not symptomatic, I can still spread it if I'm too close.
Correct. And that's the danger with coming into close contact with people, especially people who are ill. But then again, as we mentioned, some people have no symptoms, but they're still spreading the infection. So keeping physical distance is very important. Aside from that, wearing your mask. So everybody should be wearing a mask to protect other people.
Yes.
You're really not wearing your mask to protect you.
No.
You're wearing your mask to protect others. And then aside from that, washing your hands is very important. It's one of the most simple public health measures that can be taken, but it's one of the most powerful. So we really need to be washing our hands.
So Dr. Carmen, say I caught it. What exactly should I do?
Okay, so this is a great question, and I think that the number one thing that people do immediately when they get that diagnosis of being positive with COVID-19 is they panic. And so the first thing that you should not do is panic. Panic is never the answer to any situation, in particular right now. Aside from the fact that it affects your ability to make decisions, etc., it also ramps up your stress hormone, and that's really not good for your immune system. So firstly, don't panic. Secondly, we need to remember that most people who contract COVID-19 are going to have mild to moderate symptoms. And so it's really necessary to focus on taking good care of yourself, provided that you're not having any serious symptoms. So things like, for example, increasing shortness of breath, you're unable to drink fluids, you're unable to hydrate yourself, you're not passing good amounts of urine, you're struggling to control your fever, you're starting to cough up thick sputum or thick phlegm.
Say I was trying to care for my partner, he was infected, I am not. What would I do exactly to make sure I'm not infected, but for example, say he's having difficulty breathing and I can't just leave him alone?
Absolutely, you cannot,
No.
and you should not, right?
No.
So the moment a loved one, or if you develop symptoms that are concerning, things like, for example, shortness of breath, or for example, if you're coughing up phlegm that maybe is changing color, so like dark colored phlegm, these may be indications of severe disease. In particular here we're worried about pneumonia.
Yes.
And in this instance especially, for example, people with underlying chronic medical conditions, they are more likely to develop these types of severe outcomes. And so in an instance like that, if you have a GP or a doctor that is associated with your family, perhaps a GP that you've been visiting for a long time, the ideal thing would be to call that doctor and get advice, okay? Because you don't want to leave symptoms to progress without intervening early, okay?
Yes.
So either discuss with your GP, or you would need to discuss with your local clinic if you don't have a doctor available, and then you'll get advice with regards to what you need to do. If it is an emergency situation, take the patient, or in your case, if you were to be sick, somebody would need to take you to the hospital. Alternatively, you may need to call an ambulance if the situation is deteriorating, right?
Yeah.
But just make sure that when you are calling your GP, or when you are calling the hospital, or when you are going to the hospital, make sure that you call them beforehand to let them know of your symptoms so that they can prepare.
that makes a lot of sense.
Provided that you're not having any serious symptoms that require you to go into a hospital, then you're going to recover from this infection at home. So if you're able to isolate yourself at home, then that's exactly what you should be doing.
Yes.
And when we say isolate, we really mean that the person who is infected should be keeping significant distance from the other people in the house to ensure that they are not transmitting the infection to others. So this is going to be different depending on individual people's circumstances. And I understand that for some people, it may not be possible to isolate yourself completely from the rest of your family.
Mm-hmm.
But if it's at all possible to do that, then the person, so you in this example,
Yes.
would have to remain in a room by yourself with the door closed
Yes.
and limit contact with the rest of the family.
But what if I think I've already given it to my partner? Then do I just go on as normal in that household?
So it would really depend in that instance if your partner was positive. So
Yes.
if both of you are positive, for example, and you're living in the same household, then technically there's no additional risk to the two of you. However, if one partner is positive and the other is negative, then there's always a risk for the negative partner to contract the infection.
Yes.
And especially we worry about people, for example, who are elderly and people with underlying chronic medical conditions, things like diabetes and high blood pressure, for example. We worry about those people contracting this disease and developing more serious symptoms as a result of this infection. So it's extremely important to protect especially those who are vulnerable. And so aside from making sure that you are separated from everybody else in the house, it would be important to observe everything else, right? So
Yes.
wearing your face mask, especially when you are in contact with other people in your home. Of course, if you're by yourself in the room, there's no need to wear the mask. But then making sure that you're washing your hands frequently and that you're sanitizing surfaces regularly, especially shared surfaces. So for example, if you need to share a washroom with the rest of your family, you would need to ensure that you are sanitizing frequently touched surfaces like the taps, for example, and just make sure that you are trying to implement infection control measures in your house.
Say I had the virus. What medication do you think I should take?
Okay, so as it stands, we don't have any approved medications to treat COVID-19 right now. There are multiple studies that are going on across the world, and as many of you know, the development of a vaccination is really something that everybody is looking forward to. But as it stands, there are no approved treatments for COVID-19. So really what we're doing in this situation is we are treating the symptoms. So depending on what symptoms you have, you can go ahead and take supplemental medications to help manage those symptoms. For example, if you have body pain, you could take some paracetamol, or if you have a sore throat, you could suck on some lozenges. If you have a cough, you could take something to help you expectorate or get that phlegm off your chest, right? But aside from that, you could, of course, make sure that you are hydrating. This is so important. Hydration is vitally important when it comes to fighting any type of infection, and in this case, being a virus, it's important to stay hydrated. One thing that I noticed is that I couldn't eat. I had no appetite when I got sick. And it's actually important for us not to force ourselves to eat. It's almost like your body telling you that, hang on, I'm fighting an infection, I've got better things to worry about. So if you cannot eat, if you're finding it difficult, don't put pressure on yourself to do that, but make sure you are staying hydrated.